Welcome to Rolling Doe's Open Enrollment. We ask you to sit back and listen carefully to this informative presentation regarding our 2019-2020 Employee Benefits Program. Rolling Doe is committed to continuing to provide comprehensive benefits while keeping your costs affordable and competitive. The choices you make during open enrollment will be effective December 1st, 2019 through November 30th, 2020 for all benefits except the FSA and Dependent Care FSA. The FSA is effective January 1, 2020 to December 31st, 2020. Open enrollments begin on November 13th and ends midnight on November 20th. We are keeping the same medical plans with Blue Cross Blue Shield of Texas and the same Guardian dental, vision, accident, and short-term disability plans. Payroll deductions are provided in Employee Navigator. Employer-paid basic life AD&D insurance and voluntary life AD&D remains with Dearborn. Eligible employees will also be able to take part again this year in a Section 125 Flexible Spending Account, or FSA, and dependent care reimbursement options through TASK. Rolling Doe is adding a new benefit for all full-time eligible employees, cancer insurance through Guardian. Your medical, dental, and/or vision premiums are deducted from your paycheck before taxes are applied, proving a tax savings for you. Therefore, you cannot make any changes to your elections until the next open enrollment, or you experience a qualified change in status, which could include marriage or divorce, birth, adoption or change in custody of your child, death of your spouse or child, change in your spouse's employment status, or a child's loss of dependent status. You must notify Human Resources or HR within 30 days of the qualifying event to make any benefit changes. Enrollment is done through Rolling Doe's Employee Navigator online enrollment system. It's convenient and easy. In addition to the great tools and resources we are providing to you this year as a part of your benefit package, you can now view your current benefit options and elect your options for the 2019-2020 plan year through Employee Navigator. Please make sure to add your dependents to your profile in order to view all premium options for which you are eligible. Go to www.employeenavigator.com and click on Login. Click on Register as a new user if you have not logged in before. If you already have an account, log in using your username and password and click on Start Benefits. If you're new, you need to create your account. The company identifier is Roll Doe, case sensitive. Your PIN is the last 4 digits of your Social Security number. Create a username and password, agree to terms, and click on Next. Click on Start Benefits. Complete your personal information and your dependent information. Dependent data must be captured to enroll them in benefits. Social Security numbers and birth dates are mandatory fields. There is no election necessary for basic life, just save and continue. Please note, you must indicate a beneficiary if any life plan is elected. Start your enrollment, make your selections for each line of coverage. If you don't want to enroll, select Don't Want This Benefit at the bottom of the page under Save and Continue. Make sure any dependents from the Who Am I Enrolling section if you want dependent coverage. Final step, double check on what you've enrolled in. Agree to your elections and your enrollment is automatically submitted. Once submitted, you should print or save the confirmation page for your records. Rolling Doe recognizes every employee has different health needs. We offer 3 medical plans to choose from with Blue Cross Blue Shield of Texas. The base plan, or MMB4, has a $5,000 individual deductible or a $10,000 deductible for dependent or family coverage. A deductible is the amount you spend for eligible medical expenses such as hospital or outpatient services before the insurance company starts paying. The maximum out of pocket is $5,600 for an individual or $10,200 for family. This is the most that you would pay in a calendar year, including deductibles, coinsurance, and copays. The coinsurance on the core plan is 70% paid by the plan and 30% paid by the member after the deductible is met. The PPO plan has a $40 primary care physician office visit copay and a $40 copay to see a specialist. Lab and x-rays are deductible plus 30% coinsurance. MRI, CAT, and PET scans are also deductible plus 30%. Preventive or wellness visits are covered 100% by the plan. These include your annual wellness checkups, well woman exams, mammograms, age-related immunizations, and prostate exams. You have a telemedicine benefit with this plan. You can talk to a physician regarding minor infections, cold, flu, sinus issues, or other non-emergency ailments for a $40 copay. More details about the telemedicine MD Live benefit will be on another slide. The urgent care copay is $65. Urgent care facilities are open after hours and on weekends when you have a non-life-threatening illness or accident. The emergency room services copay is $100 plus deductible and 30% coinsurance. Emergency room visits should be life-threatening emergencies and not used as a primary care doctor or for any illness that could be treated at an urgent care facility or through a telemedicine visit. Hospital inpatient and outpatient services are deductible and 30% coinsurance. The base plan has a separate out-of-pocket expense limit. For prescriptions, once an individual spends $1,000 for prescriptions or a family spends $3,000, the plan pays 100% of remaining prescription charges for the calendar year. Your prescription drug copays for preferred pharmacy are $20, $40, or $60, depending on the drug category. Non-preferred pharmacy are $25, $50, or $70. Please see your summary of benefit and coverages for more information about the MMB4 medical plan, or you can visit www.bcbstx.com. The second medical plan offered is the MM32 buy-up plan, which is very similar to the MMB4. This plan also has a $5,000 individual deductible or $10,000 deductible for dependent or family coverage. The maximum out of pocket is $5,600 for an individual or $10,200 per family. The coinsurance on the MM32 plan is 70% paid by the plan and 30% paid by the member after the deductible is met. The plan also has a $40 primary care physician visit copay and a $40 copay to see a specialist. Labs and x-rays, however, are paid 100% by the plan. MRIs, CAT, and PET scans are deductible plus 30%. Preventive or wellness visits are covered 100% by the plan. The telemedicine copay is $40. The urgent care copay is $65. The emergency room services copay is $100 plus deductible and 30% coinsurance. Hospital inpatient and outpatient services are deductible and 30%. Once an individual spends $1,000 for prescriptions or a family spends $3,000, the plan pays 100% of remaining prescription charges for the calendar year. Your prescription drug copays for preferred pharmacy are $20, $40, or $60 depending on the drug category. Non-preferred pharmacy are $25, $50, or $70. Please see your summary of benefits and coverages for more information about the MM32 medical plan or visit www.bcbstx.com. The third medical plan offered is the MM24 buy-up plan. The individual deductible is $2,500 or $7,500 for dependent or family coverage. The maximum out-of-pocket is $5,350 for an individual or $10,200 per family. The coinsurance on the MM24 plan is 70% paid by the plan and 30% paid by the member after the deductible is met. The plan also has a $30 primary care physician visit copay and a $30 copay to see a specialist. Lab and x-rays are paid 100% by the plan. MRI, CAT, and PET scans are deductible plus 30%. Preventive or wellness visits are covered 100% by the plan. The telemedicine copay is $30. The urgent care copay is $55. The emergency room services copay is $100 plus deductible and 30% coinsurance. Hospital inpatient and outpatient services are deductible and 30% coinsurance. Once an individual spends $1,000 for prescriptions or a family spends $3,000, the plan pays 100% of remaining prescription charges for the calendar year. Your prescription drug copays for preferred pharmacy are $20, $40, or $60 depending on the drug category. Non-preferred pharmacy are $25, $50, or $70. Please see your summary of benefits and coverages for more information about the MM24 medical plan, or you can visit www.bcbstx.com. Payroll deductions are found in bSwift. Blue Cross Blue Shield of Texas offers additional services to covered members. The telemedicine option through MD Live provides covered employees and their covered dependents access to care for non-threatening medical issues and behavioral health needs. Access to a board-certified doctor is available 24 hours a day, 7 days a week. You can talk to a doctor immediately or schedule an appointment when you are available. Doctors or therapists can treat many conditions such as allergies, asthma, nausea, sinus infections, cold or flu, ear problems, pink eye, anxiety or depression, child behavior or learning issues, or marital problems. Call MD Live at 888-680-8646. To register, you will need to provide your first and last name, date of birth, and your Blue Cross Blue Shield of Texas member ID number. This number is located on your ID card. Another Blue Cross Blue Shield service is 24/7 Nurse Line. Members have access to registered nurses on call at 866-412-8795. Receive trusted advice on possible emergency care, urgent care, family care questions, and more. Blue 365 is a discount program helping you save money on health and wellness products and services from top retailers not covered by insurance. Sign up for Blue 365 at blue365deals.com/BCBSTX, and weekly featured deals will be emailed to you. Some deals have a short time span while others are ongoing. Vendors who participate are True Hearing Bell-Tone hearing aids, Procter & Gamble dental products, Jenny Craig or Nutrisystem weight loss products, Reebok and Skechers, Lifetime Fitness, Senior Link Care, or Handstand Kids. The Blue Cross Blue Shield of Texas mobile app is a great way to stay connected with Blue Cross Blue Shield of Texas and access important health insurance information wherever you are. Text BCBSTX app to 33633 to get the app, or download from Apple or Android app stores. The site is secure and will enable you to find an in-network doctor or facility, get coverage and claims information, or view or order a new ID card. BCBSTX uses Prime Therapeutics prescription drug program. Call them at 877-677-6337 for any pharmacy-related questions. Rolling Dough recognizes that good dental hygiene is important to good health, and participating in a dental insurance plan can help. We offer 2 dental plan options through Guardian. The DHMO dental plan does not have a calendar year individual or family deductible. You must see the schedule of benefits in the DHMO plan summary to see the list of fees per service item. The Guardian NAP dental plan is a PPO indemnity plan, which means you can go to any dentist you want, but you will see the best savings if you see a dentist contracted with Guardian. This plan has a $50 individual calendar year deductible, or $150 for family, for basic and major services only. The maximum calendar year benefit per member is $1,500. Preventive and diagnostic services, which includes an oral exam, cleanings, and x-rays, are paid 100% by the plan. Basic restorative services, such as fillings or simple extractions, are paid 80% by the plan, and you pay the remaining 20% of eligible charges. The plan pays 50% for major services such as surgical extractions, crowns, bridges, or dentures. There is a lifetime maximum benefit of $1,500 per member on the plan for orthodontia services. The plan pays 50% of these services. Visit www.guardianlife.com for dental provider information. You must choose a DHMO dental provider in the Managed Care Dental Plan Network to enroll in the DHMO. There are instructions in bSwift to find a provider, and then copy and paste the PCDID provider number where indicated in bSwift. Rolling Dough offers 2 vision plans through Guardian, one utilizing the Davis Vision Network and the other VSP. The 2 vision plans are very similar. However, the cost of the plan with the Davis Vision Network is less than the VSP plan, and the vision providers under both networks are slightly different. Under the Davis Vision Network plan, you pay a $20 copay for an eye exam once every 12 months and a $25 materials copay for glasses or single vision, line bifocal, line trifocal, or lenticular lenses once every 12 months. The frame allowance is up to $150 covered after the materials copay once every 24 months. Contacts in lieu of frames can be purchased once every 12 months with a $150 allowance. Lens options such as UV coating, tint, or other add-ons have additional copays. The VSP plan has the same benefits but does offer a different frame allowance. This vision plan pays up to $150 plus 20% of the frame cost after the $25 materials copay. Visit www.guardianlife.com for provider information to see which network is best for you and your family. Rolling Doe pays 100% of your basic life and accidental death or dismemberment AD&D insurance through Dearborn in the amount of $15,000. Benefits will reduce 35% at age 65 and 50% at age 70. Please provide your beneficiary information in Employee Navigator. Employees have the option of electing additional voluntary life AD&D insurance through Dearborn. Your spouse and children may also elect voluntary life insurance if you elect. A spouse can elect up to 50% of the employee's election. Rates are based on your age and found in Employee Navigator. Select the amount and the payroll deduction will automatically be listed. Employees have the option of electing life insurance in increments of $10,000 up to a maximum of $500,000. Your spouse can elect an amount in increments of $5,000 up to a maximum of $250,000. You may also elect voluntary life for your child or children. The same rate applies to one or all. For children birth to 6 months, the benefit is $500. Children 6 months to age 26, you can elect a $5,000 or $10,000 benefit. Guaranteed issue is the amount that you can elect before completion of a health questionnaire or evidence of insurability form. Employees can elect $100,000 guaranteed issue without answering health questions. A spouse can elect up to $25,000 guaranteed issue or $10,000 for children. Any amount elected over the guaranteed issue amounts will require completion of the health questionnaire. Your voluntary life benefit will reduce 35% at age 65 and 50% at age 70. This is a time to enroll in voluntary life if you are a new employee up to the guaranteed issue amount without having to answer health questions. There are open enrollment rules for current employees. If you are currently enrolled as an employee in voluntary life, you can elect one increment or $10,000 of additional coverage without completing health questions up to the guaranteed issue amount of $100,000. If you waived voluntary life last year, you will be required to answer health questions regardless of the amount elected. Accidents can happen when you least expect it. Guardian's accident plan includes benefits for treatments or procedures due to an accident off the job. The benefit pays you a scheduled amount based on the injury that can help supplement your medical plan expenses. Coverage includes treatments for hospitalization, emergency room, x-rays, broken bones, and more. Receive $50 each year if you see your doctor for your annual wellness or preventive exam. The policy does include an accidental death and dismemberment or AD&D benefit of $25,000 for a covered employee, $12,500 for a covered spouse, and $5,000 for a covered child. This includes common carrier, common disaster, dismemberment, seatbelt and airbag, and reasonable accommodation. See your plan summary in BSWIFT for more information about plan limitations and exclusions. This benefit is portable. Short-term disability is also offered through Guardian. Disability provides income protection when you suffer a sickness or off-the-job injury that leaves you totally or partially disabled and unable to work. Choose a guaranteed issue maximum weekly benefit based on your income, covering up to 60% of your weekly earnings. If enrolling after your initial enrollment period, evidence of insurability is required. The benefit begins paying on day 15 of an accident or illness. The maximum payment period is 26 weeks. You can return to work part-time and still be considered disabled. Some restrictions do apply. See your policy for more information. Rolling Doe is offering a new voluntary cancer insurance benefit through Guardian effective 12/1/2019. Cancer treatment can be a huge financial burden for families when medical insurance falls short or income is compromised. If you or a family member are diagnosed with cancer, the last thing you need to worry about is the cost. Cancer insurance is for anyone wanting to add financial protection just in case they are diagnosed with cancer and medical insurance alone is not enough to cover medical expenses. Cancer insurance covers medical plan deductibles, co-pays, and other out-of-pocket costs, non-medical expenses such as transportation to treatment facilities, and everyday living expenses such as groceries, rent, and mortgage payments. Anyone should consider cancer insurance, as the unexpected out-of-pocket expenses of cancer recovery can add up fast. 2/3 of cancer recovery costs are actually non-medical, such as covering the mortgage, child care, and even household expenses. Cancer insurance can help pay for all of these expenses. See your plan summary in Employee Navigator for more information. Rolling Dough offers all eligible managers and bakers the opportunity to participate in a Section 125 Flexible Spending Account, or FSA, and/or dependent care reimbursement administered by task. The FSA allows you to contribute up to an annual maximum of $2,750 pre-tax to pay for eligible health expenses such as copays, deductibles, hearing or vision, dental, orthodontia, and prescriptions. Benefits are available on day one. Dependent care allows you to contribute up to an annual maximum of $5,000 pre-tax to pay for eligible dependent care expenses, including daycare, preschool tuition, and adult dependent care. You will receive a debit card to pay for expenses. Keep all receipts and EOBs, as you will be asked to substantiate your reimbursements. Your annual elected amount will be divided into 24 payroll deductions. This benefit starts January 1, 2020 through December 31st, 2020 to coincide with your annual calendar year max medical deductibles. You must complete a separate form to enroll in the FSA or Dependent Care FSA. See HR for the form, or the form is also available on Employee Navigator. Here are a few reminders. Benefits are effective December 1st, 2019 through November 30th, 2020 for all benefits except for the FSA, which is effective January 1, 2020 to December 31st, 2020. Open enrollment must be completed no later than midnight on November 20th. Current elections will roll over to the new plan year if you do not complete enrollment in Employee Navigator, except for the FSA and Dependent Care FSA. These benefits do not roll over. Complete the FSA form and return to HR to enroll. Review all enrollment materials, summaries, and information in Employee Navigator in order to make informed decisions about your benefit plan options and elections. You cannot change your elections until the next open enrollment or a qualifying life event occurs. Contact HR within 30 days of the event to make any benefit changes. You must complete enrollment in Employee Navigator even if waiving. You must provide names of your beneficiary or beneficiaries for your new employer paid basic life AD&D benefit. You must complete the evidence of insurability form if electing voluntary life or AD&D over the guaranteed issue amount. This form is provided in Employee Navigator to download, print, complete, and email to adminservices@rhsb.com or to give the HR. If you are currently enrolled in voluntary life, please pay attention to the rules as they are outlined in the plan summary. Contact HR if you have any questions or have issues with your enrollment. Thank you for listening to this presentation. Rolling Dough cares about you and your family.